Welcome back to Take 5, an inventory series, where we take the healthcare news of the day and make the most of it that we can. I'm Alex Diamond, and I'm once again joined by Karla Hoffman and Jennifer Carberry of Family Services, a Maryland-based nonprofit that is a part of Sheppard Pratt's Community and Family Services line of programming, and also the recipient of the latest donation from our 50-450 program. I was curious about their struggles to provide mental health and other services to their community despite the disruption of the coronavirus crisis.
As COVID has exploded, people's stress level, anxiety, depression is, I think they said 40% of the population is experiencing symptoms that didn't previously.
Wow.
It's really bad. I mean, it's really kind of heartbreaking, actually, because at the same time, access to care is a much more challenging issue. So one of the things about my programs and Jen's programs are that we jumped headfirst into the telehealth world. It was quick and...
It's a very long weekend of my life, but we got it up and running on Monday morning to protect our staff and our clients and have alternate ways to continue to meet every week and support clients. Our buildings are still open. We have staff in those buildings, but we are obviously through the pandemic trying to keep folks as safe as possible, not coming in on public transportation and all the things that people have to do to access care. But intakes and the demand for services, as Karla had mentioned about the impact of the pandemic, I've been in my role about 8 years here, and this is an incredible time of people who are trying to access care. We need to expand, and with that expansion comes lots of expense, right? Not everybody had laptops and cell phones, and so we had some budget areas that we just didn't budget for prior to the pandemic that we are scrapping.
I had no line item for rubber gloves and Clorox wipes.
And 95 masks, right? We didn't
95 masks.
plan to pay for those kind of things. But so the support is just greatly, greatly appreciated.
You know, we're still a nonprofit, and that part doesn't go away, but we offer a range of services that can really meet anybody's mental health and social services, addictions needs, through all ages and all
Lifespan.
Through the lifespan and in the intensity of their issues, the severity of their issues, from early intervention and prevention work all the way through, chronic mental illness and residential treatment. And it really, I feel a lot of pride for what we do and how we connect it all. And that's good. After 37 years to still feel that way about the work that I do is just a gift. It's just a gift. So, and as hard as it gets some days, and lately it's been pretty hard. We still have some wonderful people and some success stories that just make it easy to keep coming in.
And not to be arrogant in any way, but we are saving the world.
Don't be arrogant.
We're saving the world, one kid, one family at a time to enrich our community, and we are significantly underfunded. The funding issue is tough. The Outpatient Mental Health Center has a deficit budget of $275,000 a year. We're budgeted to lose $275,000 a year.
It calls for a very dedicated staff. I will say that. We're very fortunate that not everybody's in this for the money. Right. We've curbed it a little bit during the pandemic, but we also utilize volunteers in a lot of our programs. So, if people don't have money to donate, but they've got time, we're hoping to get some of those programs back in place, a tutoring program, and we have a domestic violence shelter that people come and help us, keep those rooms up and donate bedding and things like that. I mean, it's just, there's so many possibilities, and the smallest amount of help is very, very much appreciated.
That's it for this week's episode, but you can find more about how you can get involved with Family Services and also how to nominate your favorite charity for a donation in the 50 for 50 program at z5inventory.com. inventory.com. That's the letter Z, the number 5, and the word inventory.com.